What's going on, guys? Today we're going to talk a little bit about medical. By no means am I a medic, am I medical personnel. It's just I was trained on these things, and once you're trained on it, you never forget. So without further ado, let's get into it. First thing I have here is a TCCC card. I went over this beforehand. TCCC stands for Tactical Casualty Collection Card is what it stands for. And this is everything that's going on with the patient at that time. So battle roster number, you wouldn't have to worry about that. You can just put the person's first, last name, things of that nature. Or you can put the last four of their social if you know it, if they are not incapacitated. So yeah. On here is gender, the date of birth, the time it happened, the service in the unit you wouldn't have to worry about if you are a civilian. Mechanism of injury. Is it arterial? Is it a landmine? Is it an RPG? Is it a burn? Is it a fall? Is it a grenade? Is it a gunshot wound? Is it an IED? IED is an improvised explosive device, and then you just show on there, on the body where it is on both sides. So yeah, and then you would go ahead and just sign the bottom of it. So yeah. Next thing I have here is shears. Don't know where I got these from. Had these probably a good minute. They look all kind of beat up. Guys, you may not want to have a knife or use a knife on someone. You might accidentally stab them, you know, because when it comes to training, you know, you're ramped up, you're amped up, things of that nature. So you know, to be safe, and it has that guard on there too to avoid you from cutting someone or stabbing someone. Next I have is combat gauze. Show you guys real quick. It is folded up, and it does have the directions on the back. This is the maker quick clot that does make the quick clot that's used, but for some reason they said you're not supposed to use that anymore. So like I said, I'm not a medical personnel, so that's the last thing I've heard on that. Guys, highly recommend gauze. Reason being, gauze will stretch you a long way. So for whatever reason, if you hit a femoral artery, which is inside your leg that goes up to your heart, you're gonna bleed out pretty quick. So what I highly recommend, like, I don't know if you guys ever seen the movie Black Hawk Down, that actually did happen. And you gotta pack wounds, so that's what we use. So next right here is the trauma bandage slash Israeli pressure dressing. I'm gonna show you guys that real quick. So yeah, you can't beat it. This is from North American Research. Guys, none of this stuff I bought. I was issued all this stuff, and a lot of the medical supplies, it doesn't expire. So I mean, they do expire. Should I say? Let me go back on that. Medical supplies does expire. It's just when it comes to the military, things of that nature, it's a little bit longer. So yeah. Next is just your regular old surgical tape. Have that in there. I do carry 2 blades with me. For whatever reason, the scissors go down, whatever, I can still go ahead and cut. If I have to cut some tape, if I have to cut some packaging, things of that nature. So yeah. Next is a cat tourniquet. It's still in the plastic, guys. I literally pulled, I actually just got this one, and I just threw this video together for you guys. I have to take out the plastic and set it up. Cat tourniquet. If you guys can, try to stay up to date with your tourniquets. The one I use for training, I actually found out that one is an op now. You can't even use it. So yeah, tourniquet. Next, I know everybody's gonna say, why the hell do you have this? This is an MPA. An MPA is used when you're not allowed to use the mouth, or are not able to use the mouth for airflow. What you do is you go ahead, lube it up. You can use their saliva, you can use lube, things of that nature. You can go ahead, slide it down the throat. If the person is not incapacitated but can't open their mouth, you can go ahead and tell them, hey, swallow. And you go ahead, you slowly put it down there. As you guys can see, it goes the curvature of the nasal cavity. So it goes down like that. So yeah. And you go ahead, just tape around it, and that will help them breathe if they can't, for some whatever reason, breathe through their mouth. So yeah. Next, I just have band-aids in here. Things we do, things of that nature. Sometimes, you know, you just get banged up and cut up. Yeah. Bigger band-aids. Another band-aids. I keep a whole bunch of safety pins. Reason being, guys, for some whatever reason in training, a lot of these don't stick when it comes to the tape or the adhesive, so that's why I just keep these. And then next is just some type of, actually, these are antiseptic towelettes. So yeah, I have a whole bunch of those. Yeah. And then sting relief. Actually, this looks like it needs to be thrown away, but some type of bug relief, especially if you're going to be out and about, things of that nature. I actually have sting relief, so I'm going to go ahead and trade that out after this video. So yeah. And then the last thing I have, guys, is just the basic old hand warmer. As you can see, I did have 2 I ended up cutting it in half, and I put the other one in my other medical pouch that I have. Guys, I don't use hand warmers for actual hand warmers. For whatever reason, if it's cold out there or whatever, the person needs heat, I'm gonna go ahead and crack this and just use it. So this is just a contingency that I just thought of. So yeah, guys, that's pretty much it. If you guys got any questions, let me know. Like I always say, be blessed, be vigilant, stay out of trouble. Catch you guys on the next one, all right?